Hi, I'm Dr. Lisa with Private Practice Made Easy, Your Turn to Lead. And in this video, I'm just going to kind of give my little 2 cents or reaction. It is a video directed toward doctors, but it can be directed toward providers as well. So in just a minute, you're going to understand what I'm talking about. And I'm just going to kind of react to it. So let's get into it.
Why, in fact, AI is only going to augment what I do. It can't do what I do. It's only going to help me do what I do more efficiently. AI is not going to take these doctors' seats. It's just going to sit alongside them and make these smart guys even smarter. It's going to make their workday easier because
Yes, I want AI to make life easier for me. AI is going to allow me and does allow me to spend more time with my patient.
AI is going to handle some of their scut work and leave the real doctor stuff for the real doctor. AI is not going to compete for their salary. Actually, it's going to make these smart guys more money because it's going to increase their throughput and help generate better notes and billing codes and generate better reimbursement rates.
Absolutely. Why not help me with my notes? Now I can have a conversation with my patient where I'm not like all into my computer and writing everything they say down or paraphrasing. Now AI is listening. I'm dictating and able to capture everything in my note. That way, I am getting reimbursed for all the care that I provide, all the treatment that I provide. Whereas it's easy when you're talking to a patient and you're doing the notes that you might miss something here and there. We're human. But AI can take all that and put it in the note and then recommend a code so that you are not upcharging, but you're getting paid for what treatment you provided. So absolutely, I'm going to use it.
And probably actually AI is going to save them some money too because although they are not replaceable, some of those lazy ancillary and office staff are. So
Okay, stop right there. Ancillary, my assistant, not lazy at all, far from it. Now, I will say AI can answer phone calls 24 hours a day. AI gives me the analytics. AI can tell me what numbers have called so many times in a week, a day, a month. AI can answer 5 calls at once. My assistant can't do that. But AI cannot form a relationship with my patients. Like there are some patients that call up and understand that the person who answers, who's human, they know. And they might even say, "Oh, how's the kids doing? Did the kids start school?" So that human interaction is gone with AI. So you've got to kind of weigh what you want in your particular practice. Do you want that human touch or maybe a little bit of both, having someone there to answer the calls um, 5, 8 hours a day, and then after hours using AI. But AI is definitely going to help you and save time. But as far as lazy ancillary, no.
they're going to get replaced with bots, and these smart guys are going to lower their practice costs too. And if that doesn't already sound silly to you, why don't you listen to it again? You think that you're going to use AI to manage referrals and streamline your pre registration process and AI to schedule.
Yes. My patients can call in and get a text where they can schedule their appointment. A new patient can call in or go to the website and get a link where they can set up their account, verify their insurance. It's easy for the patient. The patient doesn't have to wait for someone to get to them. AI will help facilitate all of that. Yes, it's good for everyone. It's convenient for the provider, it's convenient for ancillary staff and for the patient.
Your patients. And then when the patient comes, you're going to use an AI scribe to write most of your note before you even leave the room. And then, of course, you're going to need to use AI to come up with the diagnosis and treatment recommendations. And probably you'll use some more AI to write that after.
So I just want to make a comment that you never want to put patient identifiers into chat gpt. Yes, you could put in symptoms and kind of describe what you're looking at, but you never want to put patient identifiers into chat gpt. And when you do put symptoms or give an overview of what's going on, and you're trying to figure out maybe between two diagnoses, so you're doing your differential, AI can assist you with that. I was putting something in AI the other day, and I wasn't really sure which diagnosis would meet criteria the best with that, because it's a diagnosis I don't use a lot. It's one of those outliers, and it told me right away which one to use. So it saved me probably about 15 minutes looking up both criteria for the DSM criteria for those two diagnoses that I've only probably used one other time in my practice. So it saved me a lot of time with researching that.
Visit summary and patient instructions. And when you leave the patient room and you sign back into the EMR, you're undoubtedly going to be pleased to see that AI has already answered all your patient messages in your in basket.
So patients will actually, if they email or call and I'm with patients, they will get an answer back. Maybe a patient just called to find out if their medications were sent. They don't have to wait for me to finish up and call in between patients. They get that answer right back through AI. AI can look in the EMR, see that, oh, that was sent, and let the patient know immediately.
And then you'll use AI again to optimize the note that got started before because you want to upcode it and get the maximal reimbursement from payers. And any side work that gets generated from that visit, like DME or home health orders or prior authorization requests, well, you're going to use AI to power through those too, right?
Absolutely. Pre-auth. I just had a pre-auth today. What did I do? I had AI. AI went through my note and did the pre-auth. Now, I did have to go and put a couple things in there and edit it, but yeah, AI saved me another 10, 15 minutes there.
So you, the smart doctor, you're going to be sitting at the helm of a vast army of chatbots and large language models that have all just been optimized to help you gainfully perform your job. You, sir, are going to be at the apex of a vast clinical pyramid, just able to extract rent from all those who sit below you. By virtue of your degree and training, you will be able to insert yourself permanently as healthcare's indispensable middleman. And it will never occur, not once, ever. It will never occur to the smart entrepreneurial people who made all these AI tools that they could simply cut you out.
So they are really being sarcastic with this and basically saying, doctors are smug and they don't think they're replaceable, but they are replaceable. And so I really thought about that. And I think that there are parts that are going to be replaceable, but I don't think, because the medical community is so slow at catching up sometimes with technology. I mean, think about how long it took us with EMRs and getting that all set up. But I do think that everybody better learn AI or you're going to be behind. If you I'm going to tell my age, but I can remember in, the 90s, early 2000s, when we were trying to go to electronic medical records. And I remember the older nurses like not wanting to do that. Even the physicians, and they retired. And so I think that's what's going to happen with AI. There are some people out there that are just totally refusing to do anything with AI. And I think if they're within that retirement age, they are going to retire. And if not, you're going to have to get on board and learn AI and learn how to prompt and how to use it. It's not to say that you're replaceable. I think some things in some jobs will definitely be replaced. Don't get me wrong, in healthcare, it's going to happen. It's happening now. But I don't think that being able to write a prescription that right now is going to be replaceable for a very, very long time. So So, healthcare providers, providers out there, you need to understand AI and how you can utilize it in your practice. If you're not utilizing it in your practice, let's hop on a call. Let's go through the day to day activities in your practice and see how we can use it. And we can integrate it very slowly. We can start with just maybe the phone calls on off hours or in the weekends and being able to answer the phone. Or maybe even scribing, using it to do your notes or help out with your notes. So we can slowly integrate this in your practice, but you have to integrate this. If you don't, you're gonna end up regretting it for sure. So, anyway, this is Dr. Lisa with Private Practice Made Easy, your turn to lead. And if you and your practice need help with integrating AI, please, please, please reach out to us and we can get on a call and we can help you through that process. Hope you enjoyed.